The A1C before I was seeing Dr. Robinson was, it went up to 12. So the last time I saw her, before I was on, she had to check, I was on insulin, then she says, if it's still high, she's gonna have to put me on more days. And so she was really, really happy. And she came out and said, oh, your A1C was 7.9, and that is good. Because she said before it was almost 10. She said, oh, that is so good. So she said, I'm not gonna change anything.
So my name is Dr. Levita Robinson. I'm one of the internal medicine physicians here at our Dixwell Satellite Clinic with Cornell Scott Hill Health Center. I am an internist and I see adult patients aged 18 and up. And I'm also the medical lead for our patient transformation network. So one of the great things that we've been able to do, since we're the smaller clinic, we almost act like a pilot for a lot of the PTN efforts, which include weekly interdisciplinary meetings. What that allows us to do is to basically go over some of the patients that are in the PTN group who maybe aren't necessarily having the best glycemic control, maybe not, they don't have the best blood pressure control, to be able to kind of target those patients and see what are things that we could be doing differently that can actually help with their overall care.
My name is Rebecca Kaplan. I'm a nurse practitioner and I work at North Community Health Center in Norwalk, Connecticut. And I've been here for about 4.5 years. I think that as a practice we've transformed in a large way with a lot of different quality initiatives and created systems change. We launched a high-risk program for our patients we identified who were using the emergency room a lot. And then through our certification for developing a program called We Care, we actually expanded it and are looking much more closely at it through PTN as well. We've done longer appointments for our patients. We've increased our communication with the hospital astronomically. We even have something called Tiger Text with every one of our providers. We're able to communicate in real time if patients of ours is in the emergency room. We do patient-centered care plans, longer appointments, focused care team meetings, where we're all sitting around a table and really talking about what's going on with the patient in the community as well as medically.
I am Carlos De Leon, MD. I am the PTN Grant Coordinator here at Community Health Services in Hartford, Connecticut. Well, I think patients are a little bit more in tune with their own health now. And patients are actually liking it a little bit more, that we have a little bit more services to give them. And they ask more questions, so the interaction has picked up since we started all these changes. So this is our finger pulse oximeter that we acquired through the PTN grant, and this is for our asthmatic patients and COPD patients that we do spirometry on. With this, we determine that they need some help or we need some data from their own houses, and we use the pulse ox in order to get whatever the pulse ox is at home. We also have a pedometer. So for our diabetic patients in our diabetic clinic, most of them are going home with a pedometer, counting steps, just to make sure that they're keeping up their physical activity. You hear a lot of comments of them going out through the stairs and, going down the elevator that, things have changed and for the better. We've been able to call other health centers like Stay Well for risk stratification purposes, for, patient portal purposes, Charter Oak, and around our area, just talking about and bouncing off ideas from one another. Healthcare has changed a lot since I started, dealing with the healthcare system, and I enjoy it. I love it. I come in, with a purpose, and I just love to work, and especially this quality work that we're doing. And since I learned a lot more about the PTN and about our patients and about our health center and other health centers, I enjoy it. I love it, and and just changing one patient's life is not enough, but it's great.
I feel great.